Hi guys, sorry I can't be there today. So I just thought I'd quickly record a video for you, and it's available with a few other videos on my YouTube channel. So the things I want to talk about today are the new testing in Warwickshire, who should use it, and also just let you know that I've done a new link on my YouTube channel on Am I a Close Contact for those schools who are still querying whether they are a close contact, whether you've got staff who are unquite sure. You can send them this quick video and it can describe to them different scenarios in which they may or may not be a close contact. It might help them out to identify that. And the other video is going to be about household contacts. We do have quite a few queries of when multiple members of a household test positive and whether they should or shouldn't stop self-isolating. So just to let you know that those videos are now there for you to use. So the only thing I want to talk about today really is about the new testing in Warwickshire. So at the start of term, we sent a letter home to all the schools, which stated that to parents basically that if their children are unwell, that they shouldn't come to school while they're exhibiting sort of highly the symptoms of a cold. Now, this isn't new guidance. This guidance was before COVID, and obviously we don't want any bad colds going around our schools at this current time, as much as we don't want COVID going around our schools at this time. So at the start of term in the November, we sent letters out to schools and we asked them to send out one to parents to stop them coming in when they're unwell. Now, since the half term, I've also queried with the regional testing centre around the amount of testing capacity that we have, and we found that we have quite a bit in Warwickshire that we could utilise. And I posed to them whether we could increase testing in schools in Warwickshire, and they agreed that I could, and we've been slowly increasing the amount of testing that we're doing in schools in Warwickshire. So when a school has had a number of cases, we're talking quite a few of a cluster in a year or quite a few cases across the school, and they're seeing common cases now of COVID, then actually cold symptoms, which we know could be a sign of COVID, it is useful to test generally cold symptoms. So we've created a letter which goes out to that school and with instructions on how to book online. And we're asking any families that if they have children who are unwell for any reasons like sore throat, runny nose, feeling really unwell with fatigued, and a headache seems to be the main symptom. If a child reports any of those, just while they're feeling unwell, just pop and get them tested. At the minute, we're getting test results back as quickly as 12 hours later. And it's just so we know that they definitely haven't got COVID. And that is working really well in schools in which we have had COVID cases. So it's an extra tool for us just to check if there is anything that's moving through the school that's showing to be looking like a general cold, but actually it's more than a cold, and that has been really helpful. The reason being that one child staying off for a day or two as they're unwell anyway, and we don't want colds going around the school anyway, could save us, whereby we could have as many as 140 kids off for 14 days self-isolating. And as you know, in years 9, 10, and 11, you can have a child go from class to class to class over a space of a couple of days. So they would have as many as 140 kids that they could be in close contact with. The only thing about it is that we are not asking whole families to self-isolate while they're waiting for their child to be tested for the lesser symptoms of the things like the headache, the sore throat, the feeling really, really unwell, and sort of the runny nose, all those kind of symptoms. We are asking families not to self-isolate. We don't wish for everyone to use this, only those schools which have cases. The reason being is we still only have about a 2 to 11% positivity rate. So out of 100 people that go to get tested, only between 2 and 11% will actually be COVID. So the other sort of 89 people are unwell, but they don't have COVID. So we really want to only use this in schools which already have cases, because if we use it in schools that don't, then the general census is we are going to only pick up colds, and we're going to put a lot of kids through a lot of tests when we know actually in the school we haven't had cases of COVID and that it's very unlikely to be COVID. We're only using it currently in schools that we have had cases of COVID and the cold symptoms have a good chance of being COVID. And by using these extra tools, we are preventing transmission. We don't want schools to just kind of jump up and do it themselves and send out letters themselves. I have 2 letters which I have to send out together, and it just means that we have it a bit more controlled and we have some more idea on the numbers of schools who are doing it. So if you have got a number of cases in your school, chances are I have already approached you around this, but this is just a new testing going forward. We have got obviously a lot of schools at the minute who've never had a case before and are seeing more cases of COVID in the school, and so we might be working with you very soon on this, but just to let you know. So that's actually everything for my update today. I will be seeing you next Tuesday with more information. There's a lot more happening which I probably will have to update you on, and have a great week, and thank you. You're doing such an amazing job. I can't believe how hard the head teachers have been working over the last week and the weekend just gone, and just keep going. Just 4 weeks till Christmas. Thanks guys, and I'll see you next week.